Part two now of my interview with the Chief Quality Officer at Desert Regional, Christine Langenwalter. One of the biggest concerns for all hospitals right now is staffing. Have you received any assistance from the state or the county, and how is staffing right now?
Staffing right now is always challenging in our winter months because not only do we have sicker patients that are coming in and fuller beds, fuller bed rooms, I should say, but we also have a number of staff physicians that they themselves are out on leave or sick or for various reasons. Staffing becomes tight normally for us in the winter months. We have resources throughout our mother hospital that we're using as central staffing resources. We're also requesting contract travelers through different travel agencies and things. And yes, we have submitted a state staffing request as well, and we're waiting to hear how that is going to come out.
How is your surge plan right now, and have you had to make any changes?
Our search plan is a work in progress. It's been evolving since this started in February and March. We have not gone back to the point of putting cots in our lobbies and things like that. Although on a state call today, they have recommended that we start those plans in place again, just to be on the safe side and not to be caught unaware. They are requesting that we also have triage areas and things like that available outside of our ER to make sure that we have adequate space to care. So we have some outlying buildings and things that we can use. We have opened our ED annex for Med Express, which is kind of an urgent care version of the emergency room, just to open up and give a little bit more space. And then for ICU, it's oftentimes very concerning when the public hears we're at zero ICU capacity. But I want to reassure the public that every room in the hospital can be made into an intensive care room if necessary. We bring the equipment that's needed, we bring the staff that's needed. And so, yes, we are full in our intensive care unit, and we are overflowing into multiple other areas for intensive care. But those patients have the equipment that's necessary and the nurses and staff that's necessary to care for them in those different areas.
We heard yesterday that in Los Angeles County, nearly every hospital there was on diversion at some point. Has the hospital had to turn away any ambulances?
Because we're a valley area here, there's just basically 3 of us hospitals with a few outlying, High Desert Medical Center is one of our small sister facilities and stuff. So we don't have a lot of options to send patients if they need to outside of our area. So we typically are not someone that the county would let divert. However, we have to make sure each patient is in the right place, the right level of care, the right bed, the right facility. And sometimes that involves a lot of discussions with our skilled nursing facilities, other hospitals, transferring out to some of the bigger hospitals in Riverside County if they have bed availability. So it's a lot of communication and coordination. No, we have not diverted, but there's times where we are open only to some of our most critical challenges, such as myocardial infarction, heart attack, stroke, those types of things, trauma, obviously.
Finally, Christine, many of our viewers plan to gather for New Year's Eve. Is there a message you would like them to hear? And if they do plan to gather, what do they need to know?
So one thing through the pandemic, I think we all miss the social interaction and the family time and the fun. And I think I certainly am extremely excited to bring in the new year of 2021. I would encourage people to celebrate that with your own household. Don't bring people in from outside of your household. And in the event that there are gatherings, please keep them extremely small. Please bring out the hand sanitizer, keep the masks on. Above all else, if anyone in the community is feeling ill, please stay at home. I think sometimes people have some mild signs and symptoms and they may still run to the grocery store or do some different things. We ask you, if you're not feeling well at all, then please stay home. Please isolate yourself. Please get a test, find out for sure what it is. And then I can't say enough that as we're celebrating the new year, please remember that we have all of our true heroes are on the front lines at the hospital. caring for all the patients coming in. Our nurses and our doctors have been working extremely long shifts for a very long period of time. And everything that the community is doing on their end is going to help our staff on this end be able to care for people more effectively. So we really have to band together as a community and really fight to eradicate this as quickly as possible.
All right. Christine, we appreciate your time. Thanks so much for joining us.
Peter, I enjoy talking to you, and great job on your broadcast. I enjoy watching you. Very great job.